Hello, everybody. It is Thursday evening, and today I woke up after editing the vlog that releases tonight, and I stayed up till like almost 1 o'clock. The last entry, I was almost half asleep, but I woke up and I got it done. You know, with the vlogs is that once I get started in the vlogs, I can't stop. That really is how much fun I'm having. Anyways, I went to sleep 1 o'clock, woke up 7 o'clock, and checked my social media and saw in a Facebook group, not my Facebook group, but one of the health information Facebook groups, there was a post talking about how Amazon is now recognizing health information professionals and coding professionals. Now, it was just a post. There was no links or anything like that. So that morning, I went ahead and, of course, did my research. I wanted to find out if there was a health information position or even a coding position, a medical coding position for Amazon. Now, I did not find a medical coding position. Okay. I went to Amazon Care. That's what the service is called, or the healthcare sector for Amazon. It's Amazon Care. And I checked the career section. There's two parts. I think there's the medical part and then the service part. There was nothing specifically in medical coding. There was nothing specifically in health information management. But so I went ahead and did a general search on Google for Amazon Care health information management, and I found one position. It's a health information management specialist position. I'll put it up on the screen here. And what's nice about it is that it recognizes the need for certification. The certifications that they require is an RHIA or an RHIT. It's like, I guess, new to me to hear Amazon mention AHIMA credentials. So I'm looking at this full job description. I don't even know what this position is. The title is Health Information Management Specialist. Well, what exactly is the role? The role is not very specific. It's just very customer based. So hopefully, and this job is not, I don't think it's a remote position, because I'm sure you all are going to ask, is this a remote position? This position is based out in, where is it based out in? Seattle, Washington. So for all of the geeks up in Seattle, Washington, there is a possibility for a health information management specialist position in your area. With that being said, what's the possibility of Amazon going into health information management, going into medical coding? I see it as a possibility. Another event that has also happened is Nuance, I believe, was bought out by Microsoft. So there is a merger in that aspect, in where Microsoft wants to get into the healthcare sector. Okay. Now, the way I see it is, I see Amazon providing healthcare because they do have telehealth services. But with anything that they provide, especially in some type of healthcare service, there is a definite need for health information management professionals. And number two, medical coding. Okay. So please keep an eye out on it. It's very early in the stages. If you guys want to be Amazon employees or even Microsoft employees, could you imagine that? I'm also kind of forecasting, what about Google? Google would be an awesome company to work for in the health sector, and even Facebook. But the way I see this whole entire thing with technology merging into healthcare, it has to do with healthcare data. And I've said this all the time, when electronic health records were implemented. I've said this in previous podcasts. When I just graduated out in 2003, electronic health records were just rolled out. Now we're in 2021, and the biggest importance, or the biggest focus now in healthcare, is healthcare data. And so for professionals now and new students or new graduates coming into the field, your focus should now be not just on health information management, not just on medical coding, but now healthcare data. The question now is, what do you do with that data? And then with that regard, do we have enough professionals to handle and interpret that data? So I'm going to leave it at that. Amazon, health information management specialist. It can open a door to a lot of the technology companies going into health information management and medical coding. All right, it is Saturday morning, and no vlog yesterday because my son had his first spring football game, and by the way, the team won. So we were up all afternoon. I had no chance to vlog. But in today's segment, I will dedicate this segment to a YouTube channel titled All Things Quita. I think I'm drawn to the title because my last name is spelled C-U-I. It's pronounced Qui. So All Things Quita, Qui, Brian Qui. You can see the connection there. But please check out our YouTube channel, All Things Quita. And she does videos on a day in the life of a medical coder. I followed it early on. What drew me in was her skincare routine. Because when I started this YouTube channel, before this YouTube channel, my face was horrendous. And I never took attention to taking care of my face. And so when I saw her do her skincare routine, it kind of jump-started me to okay, you got at least wash your face, exfoliate your face, and do all of that. But I've been following her, and her most recent video titled, and I will post links here and whatever notifications in this video, realistic DITL. DITL stands for Day in the Life of a Medical Coder, Remote Notary, and most importantly, learning ICD-10-PCS. So her journey is unique. I believe she is a CRC, or I believe CPC. Either way, she has an AAPC credential. And the focus of the AAPC credentials is mostly in CPT. So now she's studying for her CCS, Certified Coding Specialist exam that is brought to you by the AHIMA, which I hope they remove flagging off of their exams. And she was working with her ICD-10-PCS, and her struggle is navigating through that huge ICD-10 book. Now, I wanted to share how I learned ICD-10-PCS, and this happened to be when I was a CDI specialist for a healthcare system in South Florida. And the HIM department brought in, they went to AHIMA, they brought in 2 trainers, and they are like top-notch trainers. The first one is Gail Smith, and the other one is Lynn Kuhn, LYNNKUEHN. They are a dynamic duo. So if they're ever together, Just know you're getting top-notch education, which I did. What I took away from the training session is this. If you can at least get or figure out the first 3 digits of the PCS code, everything else will fall into place. Now, okay, I forgot for a second, but the first 3 digits are, the first one being the section. Okay, I'll go over it in a second, but basically it is the hospital setting. And when I show you this specific tool, a majority it falls under this specific one. Number 2 is body system. So you have to know your anatomy. When they rolled out ICD-10, I studied it for 3 years prior to 2015 rollout in October 1st. So we spent 3 years, 3 excruciating years of learning ICD-10. So anatomy is important, but the most important, I feel, is the root operation. If you can at least get that, everything else falls into place. So again, get the section, get the body system, get the root operation, and you're set. But then also then is the approach, which ties into the body system. But I think if you get the body system and the root operation down, you can follow through by looking at the operative report and then fighting the body part. There's a reason to it, okay? And you'll see that if you get the first 3 in, sometimes the body part is not that you want in that operative report may not be listed in the table. So it's weird. ICD-10 needs some work, but the first 3 digits are the way to go. Now, the way I was taught was, I believe it was a 3-day session with Lynn Kuhn and Gail Smith. And they offered me, well, let me flip these around. They offered me these, they gave me these cards, okay? And these cards are root operation cards. And I know Lynn Kuhn is part of Liebman Education. So these specific cards here are the Liebman Education. And these are just root operation cards. So when I finish the training, okay, then you have to go into the field immediately. This is not for a test. You're in the field working with ICD-10-PCS. You're trying to figure out, all of this stuff and trying to code them all and validate them all. And these helped me a lot. One of the things that is hard is that, of course, these are separated, okay? And you have to keep them together. And if you need them, you got to flip through them and so forth, like you're some type of blackjack dealer. What my colleagues did was they poked a hole right here and they added a ring to it. So that way they kept it together, okay? Now, let me show you this tool. Which is if you could see it, it is the ICD-10-PCS Flip Bits tool by the Haugen Consulting Company, or Haugen Consulting Group, but specifically the Haugen Academy. And they gave me this, which, by the way, they do help support this channel. I really connected with them. I connected with them really early on, like 2017, 2018. And they have these flip bits. And so you see here, these are all separated, but here, these are all connected. Okay, it already solves that problem with that. It has a spiral binder on the top, and it has everything listed all the way down. These are listed by the first digit, but let me tell you something, Quita. When you work as an inpatient coder, as you notice, you see here the first digits, there's med-surg, there's obstetrics, placement, administration, measurement, and monitoring, extracorporeal, blah, 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 whatever. All these other stuff, I never really worked with, okay? And what I did work with was just the med surg. So you could see where a big chunk of your ICD-10-PCS work will reside. So I'm just talking for when you're in the field, not specifically in the exam, because I know in the exam they're gonna ask you some of these things below. Okay, but I would tell you in the field, obstetrics, aside from med surg, obstetrics would be some place to look at that I have seen. Placement, not so much administration, unless they are transfusing or if the hospital codes transfusions. I've seen monitoring and measurement, especially when they place arterial lines in the ICU. But other than that, imaging, nuclear medicine, radiation therapy. I mean, the question is, I know radiology for the most part in most hospital systems, they don't code the imaging, but if they do, and I've seen it, it's for statistical purposes only. Radiation, I don't know if they do. Radiation is inpatient. Mostly it's done outpatient, unless it is a oncology unit that specializes in that. But other than that, nothing else. But mainly you're going to be working with med surg. Okay, so at least I gave you the first first digit, right? And the second digit would then be the body system. So I'm going to leave the anatomy and physiology to you. But the root operations, the trick is to always reference your root operations and know what they are. And the flip bits here, take it a step further here. So let me give you an example what my worst one was. When I first started, when I finished the education, my biggest hang up, like I always had to what I have to look it up, was excision and resection. And so I always had to refer to this red one. And I knew right away, okay, I'm stuck again. Resection, excision, I'm going to pull out this red card. Okay. And what's nice about this card is that it explains you the difference. So it gives you something to base it on when you're reviewing the opera report. Now this is the same thing here with the flip bits, but I know, but it's not by the title here, it's by the definition of the title. So when you're looking through an opera report, you have to ask yourself, what is that surgeon doing? And you always have to put yourself into the mind of the surgeon, which, by the way, if you're watching Netflix, watch The Surgeon Cut. It's a really great documentary. But here it tells you by the definition or the classification or the category of the specific root operations. And you see here, they list them all here. Okay, it is listed by root operation, the actual definition, and then the example. So this tool helps me. And for those studying for the CCS, I highly suggest you get either one of these tools. I'm just being fair, okay? But just to let you know, I'm going to link this one below in the comments. Also, if you use the link, there is a promo code, okay, that you can use for special pricing. But yeah, that answers that question. If there's anything I can do, Quita, to help you with your CCS and ICD-10, please let me know. So I'm reviewing this chart. And remember, I think a few vlogs back I mentioned when you're auditing, you'll look at a set of codes and you look at it. And there tends to be, when you're auditing, a code that sticks out like a sore thumb. Let me give you this code description, okay? And I'm going to give you a bit of rationale why I think I should remove this code. First off, the code is 060.03. The description is preterm labor without delivery. Third trimester. Preterm labor, or anything preterm in OBGYN guidelines, is anything before 37 weeks. So 37 weeks and I think 6-7 days before that. Before 37 weeks is preterm, right? So remember the description, preterm labor without delivery. You know why this thing sticks out like a sore thumb? The patient had a C-section. So that constitutes as a delivery, right? So that automatically negates or devaluates that code. Preterm labor. Well, here's the thing. Preterm, right? The patient is, she's at 39 weeks gestation. So why would it be preterm? The patient's full term. 37 weeks and above is preterm. 37 to 40 weeks is right at term. Anything after 40 weeks is post-term. So I don't understand why this code was assigned. Preterm labor without delivery. Patient is 39 weeks gestation and had a delivery. I don't know why people assign these codes. You have to understand, at least in OBGYN, gestational weeks of the mother and the baby. The reason why they came in for delivery. Is it induction of labor? Is it a scheduled C-section? Or is it spontaneous labor, spontaneous rupture of membranes, something like that? I find, for some reason, I connect more with OBGYN because I've done it as an inpatient coder. And of course, I've had 3 kids. So I followed my wife's journey in her deliveries. So I have an idea, right? As a dad, I understand OBGYN. I connect more to it. But yeah, that code, 060.03, adios. That thing needs to go.
MedicalCodingGeek.com